Okay, case number 4. Case number 4 is a 42-year-old female who is a patient that was involved about 5 days ago in a multi-system trauma, was ejected from a vehicle at rolled a high rate of speed. Patient was initially taken and presented to the presented to a smaller level 3 trauma facility. At that time, she was intubated and placed on appropriate ventilator settings, was taken to the operating theater where a hepatic and splenic laceration was repaired, apparently with success. However, during the patient's stay in the ICU, noticed that her arterial blood gases indicated refractory hypoxemia in spite of FiO2 being increased and in spite of high levels of PEEP. You currently find the patient supine in the ICU bed at the sending facility. They are requesting that you transport a patient to a larger level 1 trauma facility for care and pulmonology services unavailable at the same facility. You go ahead and note the following settings: an FiO2 of 100%, patient is only saturating at 85%, PEEP of 10, respiratory rate of 15. A patient is taking no spontaneous breaths at this time. Mode is assist control. You see a tidal volume of 600, which is an appropriate volume based on a patient's ideal body weight. I want to go ahead and just notice that you do note a elevated peak pressure in the 60s. Also of special note, if you could take a look at the pressure or the volume pressure loop, you notice a pattern on there, a distinctive duckbill pattern on that loop. This is going to be clinically significant for a certain problem. You go ahead and decide to close out your loops. You notice that your peak pressure is elevated. At this time, you will initiate an inspiratory hold. You'll wait, and the hold will be initiated on the next breath. Initiate the inspiratory hold, and you notice a plateau pressure of 58. So both the plateau pressure and peak pressure are elevated. These are both clinically significant. If you guys want to take a couple of minutes to talk about what you think may be going on with this patient and things that we can do to treat her. Thank you.